I'd like to ask you, in the FCT that you coordinate, what is the emergency response time like when you get a call? How long does it take, before I think you basically transport. I don't think the ambulances take care. But you speak to us about that. How equipped are the ambulances, and then if it's just transport vehicle, and before you get to the centers that are designated for care. And I'd like you to speak about funding for this very important part of healthcare. We hear about budgets, for health. Is there something specific for emergencies? Because even in hospitals, you go to certain government hospitals right here in the FCT that cannot take care of, minor emergencies because they do not have the facilities. So speak to us about that.
Okay, I'm trying to unpack your questions, It's quite loaded. I'm going to start by saying the essence, just like the co-chairman of the NEMTC said, is to save lives. That's the most important thing we do. First and foremost, how do you save a life? Whether you're going to save this life in prime time or you're going to save this life, do you want to save a life?
Yeah.
So in the present situation we find ourselves, the most important thing we do in order to take it out from the hands of the Okada man or the man who is a bystander is to do what we call scoop and run. So first and foremost, just take this patient as much as possible and convey to the nearest healthcare facility. Now, we're going to leave that at the doorstep of the consultant. Basically, a lot of the ambulances that we have in the FCT currently are, basic life support ambulances, just to sustain the patient from the point of the incident to the nearest healthcare facility. So yes, the ambulances, they are basic life support, so they can also provide some level of care. Those are the ones that we have accredited. Okay. Now, the ones that the road safety may provide, just like the consultant said, these are persons who were given minimal training so that they can render service. They may not be healthcare providers, but they are drivers, or that level of service providers. So for the services that are rendered under the FCT Emergency Medical Service and Ambulance System, all the ambulances are fully equipped to provide pre-hospital care before you hand over to the consultants in the hospital. The National Emergency Medical Service and Ambulance System is one of the gateways through which the Basic Healthcare Provision Fund provides care to Nigerians. There are about 4 gateways